So I get so many requests about different types of issues. So I'll have people talk about Menieres. What do you do for Menieres? What do you do for MS? What do you do for dementia? What do you do for Parkinson's? And what people don't understand is that even though it's labeled a certain diagnosis, what are you going to do to make some change in the nervous system? That's the question. So you can have a diagnosis of, let's say, MS, and there are 12 different scenarios for MS. So none of which are the same. You can have a variety of symptoms with a variety of neurodegenerative conditions. So the diagnosis means then they're going to throw meds at it. Maybe they'll do a little bit of physical therapy. So we don't really want to consider that. We want to consider what is actually happening in the nervous system and what can we do to change that without extreme amount of neurofatigue, which means that we can't exceed the metabolic rate of that nervous system. So, and it's different with everybody. So there's certain parts of the nervous system that may be high functioning and some that are low functioning, and we don't want to go in guns a-blazing for the low functioning areas because it's not strong enough to handle that. It's like going to the gym and doing 50-pound bicep curls, and you haven't done a bicep curl in 10 years, and you try to do 20 of them. So you're going to blow out your nervous system, blow out that muscle. So it's the same thing in the nervous system. We have to take each individual patient and look at what's happening and then try to find ways that their nervous system would respond in a positive way. And so that's the basis for my treatment protocols for any type of condition, whether it be musculoskeletal, neurodegenerative, sports injuries, any of the above. So, and patients ask me that constantly. And so, can I do exercises at home? Well, we're doing enough right now that you probably don't want to add exercise until we get everything stabilized. So that's kind of where Souter Chiropractic is different from other types of programs. So give Souter Chiropractic a call if you have more questions at 303-385-3432, or you can find me at souterchiropractic.com.